February is Heart Month, but no matter what month of the year, it's always a good time to show some love for your heart. Because most heart diseases or cardiovascular diseases can be prevented. I'm Dr. Freddy Gomez. Today, we'll talk about steps to keep your heart healthy. This is Med Talk Health Talk on CNN Philippines. Cardiovascular diseases are the #1 cause of death in the world, including here in the Philippines. These are diseases of the heart or any illness that can affect your heart. According to the World Health Organization, almost 18 million people died from cardiovascular diseases in 2016. And that represents 31% of global deaths. And it happens in low and middle income countries. Joining us on the show are Dr. Michelle Marie Pipo. She is a cardiac rehab specialist from Fatima University Medical Center. And we also have Ms. Bona Gwen Cadorna. She's a physiotherapist from Coach Pro Manila. Welcome to the program. The Journal of the American Heart Association released a study last year saying Filipinos are at greatest risk for heart disease and stroke. In fact, here in the Philippines, the health department has launched a national heart attack prevention campaign, because the Philippines remains to be one of the countries with the highest prevalence of heart attacks, and we need to understand why this is so. Let's start with what are the most common causes for heart attack?
Okay, the most common causes of heart attack would still be lifestyle diseases and of course hypertension, diabetes, and dyslipidemia.
Okay. So all of these factors, when present with a person, what are the chances that they will have a heart attack?
Okay, so not everyone, by the way, who have hypertension or all these diseases will actually suffer from heart attack. But some of the risk factors can also be related to a family history, or if you had it in a family, like someone in your mother or father actually suffered also heart attack early at their age, that must be less than 60 years old when it happened, then you can also have it, even if you are living a healthy lifestyle.
Okay. Now, Ms. Cadorna, being a physiotherapist, you deal also with patients who suffered a heart attack, who have encountered a heart attack or maybe even a stroke. Do you find their recuperation time very challenging?
It depends on the patient as well. Usually, the exercises that we do, it depends on the patient if they are very cooperative with the exercises that we provided. And sometimes it depends on the surgery that they have undergone. So sometimes when they have undergone the bypass surgery, we don't recommend of movements like above shoulder level because of the one that they have.
What is common here is you work closely with the doctors in designing your treatment and trying to find a way to get them back on their feet as well. Now, Doctora, heart disease, heart attacks, stroke is no longer a disease of the elderly. We see this trend of it occurring to younger and younger people. What do you think could be the cause of this, or what could be the reason for this trend?
Younger generations now don't exercise. Remember, in the past, most of the children were playing or engaged in exercises like pico, something like that.
They were outdoors. They were doing entertaining themselves with physical activities.
But now most of the children are just engaged in cell phone or media.
The experts are already saying that there is a marked increase, or the increase in chance of these heart diseases if your child lacks physical exercises.
Second is related to the diet. Okay, most of the patients now, or the younger generation, likes to eat fast food. Most of the younger generations also likes to eat sweet foods and fancy foods at that. Okay?
So it's the kind of diet that people are eating as well.
Yes. So diabetes and hypertension, as well as high cholesterol, are all contributories to this.
Okay, so we'll talk further about those factors and what can we do about that after the break. Now is the time to take care of our heart and our health to prevent heart-related diseases. When we return, we'll focus on the most common heart diseases and their risk factors. Some of them you can't change, but there are others that you can. More after a very short break. You're watching Med Talk Health Talk here on CNN Philippines. Welcome back to Med Talk Health Talk. And today we're talking about keeping a healthy heart and how we can prevent heart disease. There are different types of heart disease that affect different parts of the organ. Still with us is Dr. Michelle Marie Pipo from the Fatima University Medical Center. And we also have Ms. Bona Gwen Cadorna from Coach Pro Manila. So going on with the conversation, what exactly happens to a person's heart when they're undergoing all these cardiovascular diseases?
When a patient suffers from heart disease, they must have those risk factors like dyslipidemia, diabetes, or hypertension.
Okay.
So it doesn't just happen overnight. This develops from the time that they eat all those fatty foods or from the time that they lay in a couch. Since this creates an inflammation in the blood vessels,
Okay.
when there is a stress or when the blood pressure goes up, then that causes small rupture, intimal rupture in the blood vessels.
So parang nasusugatan yung mga blood vessels.
Yes. And then those food that you eat goes into your blood, and those cholesterol flows in your blood, and slowly they seep in those small injuries in your blood vessel, and that creates atheroma or plaque formation. So that plaque formation is actually caused by lipids. So over time, because of the risk factors that I have mentioned, hypertension or diabetes, and even dyslipidemia, that causes obstruction of your coronary arteries, which was previously smooth and elastic. Okay? So over time, that becomes non-elastic, full of fats inside. Suddenly, one day, when you have a stressful life,
A stressful event or something that
stressful
causes
event,
a lot
or
of
an
stress.
increase in blood pressure, that suddenly ruptures, and that causes blood to come out, okay? And that blood thrombus, we call that thrombus, eventually obstructs the blood vessel,
Right.
and there will be no more oxygen flow going to your heart. And so that at that time, your heart sort of like dies.
So, Ms. Cardona, in your experience, when treating patients who have had a heart attack or who have had a stroke, is it difficult for them to recover? Is it very challenging for them?
It is very challenging, but they will recover. When we started a rehab or tried to motivate them to do exercises, at first it will be very hard, but at time we give them a patient education, we tell them what will happen if you do exercises and everything. So they will try to follow the program that we will give them, and then everything follows.
So all of this again is very tailor fit for the patient. All of this has a system to it. It's not just like doing things haphazardly. There is a system to everything that is done for the patient. Now going back, doctor, you talked earlier about some of the risk factors and what causes heart attacks. You know, diet was a big thing. Can this still be modified? Is there still a way in order to improve what can be improved?
By the way, let me add that smoking and alcohol intake also is a risk factor. If your patient would stop smoking, if he would stop all the vices that he have, if he will just be active, but I don't want to give that impression that exercise will always make you healthy.
Okay. It'll erase all the bad things that you've been done over the years.
Yes. Okay, so, but if you begin your healthy habits now, that will somehow create a better impact in the future regarding these diseases. These are very important interventions. If we will just comply with their diet recommendations by the physicians and their doctor, by the way, and then of course, if they will comply with the necessary exercises prescription, or just engaging in a regular 30 minutes, 5 times a week of exercises that will keep their heart pumping, is somehow fine for them to lower the risk of cardiovascular diseases.
So do you think someone who is diagnosed with hypertension, heart disease, probably goes to a doctor and sees that they have plaques or blockages in their arteries, and they decide, okay, I'll just eat healthy, I'll just exercise a bit. Is this enough, or should they have a doctor who is constantly monitoring them, making sure that they're doing the right thing?
Let me correct by saying that when you do this monitoring of the risk factors, you have to consult, of course, your doctor, and then make sure that you're getting to your goal. Because your blood pressure has a goal. We have to get a blood pressure of at least less than 140/90 or lower than that, okay? And then we have also certain goals for patients who have not suffered heart attack yet versus patients who are just preventing heart attack, okay, for cholesterol levels or LDL. And so the same goes for sugar. We also have the same goals, okay? So we need to make sure that all the goals are being met just to somehow make us comfortable that we're far from suffering all these cardiovascular complications of these lifestyle diseases.
That's right. I couldn't agree more. And I think it's very important to have a good relationship with their heart doctor. And it's also important for probably the facilities needed for that. But we'll talk more about lifestyle diseases that affect your heart and how we can properly treat them. And more importantly, how we can prevent them. I'm Dr. Freddy Gomez, and here on Med Talk, Health Talk, we're talking about loving your heart, taking charge, and taking matters into your own hands to fight heart disease and other lifestyle diseases. Still with us is Dr. Michelle Marie Pipo from Fatima University Medical Center and Ms. Bona Gwen Cadorna from Coach Pro Manila. So let's continue the conversation on these lifestyle diseases and what can we do to actually change it for the better.
So let me start by saying that first you have to quit smoking. For everyone out there, you have to quit smoking. Even just a single cigarette can affect your heart. Second is moderation in alcohol drinking. Third, you have to exercise. And you have to lower your salt intake and fatty food intake. Now, once you have an inkling or an idea that you might already be prone to these lifestyle diseases because of your age, because you have a family member who suffered from heart attack, then that must lead you to have a checkup to your doctor.
Which is very important.
Yes, which is very important. So there are simple tests that can actually be done. These are usually done every year, especially when they are at work. So you can just do a simple ECG.
What some people might call this an executive checkup.
Yes, an executive checkup. So they might just request for an ECG, a lipid profile, a fasting blood sugar, and then check also their liver test because that might already give you a signal that you're prone to diabetes because you have a fatty liver. Now, because we have mentioned that some of the lifestyle diseases may be asymptomatic.
Right.
Patients will not feel anything. Okay, so they don't have chest pain, they don't have this headache that most of the Filipino people are actually relating to hypertension, nape pain or headache, but not all people with hypertension have those. So if you have this idea that you might, or you just fear like you have one of this, you're just into your road of getting into the new lifestyle, good lifestyle, okay? So you might just want to have a stress test, especially if your age is already beyond 40 years old for male people, because you are already prone, or you might be at risk for developing cardiovascular diseases at that heart attack if you have hypertension or all those diseases I have mentioned earlier.
Okay. Now, Ms. Cadorna, how important is it that the person treating the person who's already had a heart attack or a stroke is very knowledgeable with the subject matter, is knowledgeable or has had very good training with regards to rehabilitation?
Yes, it is very important because we don't want the patient to have more problems, right? What we do initially is we assess the patient. So we will know what is the underlying condition that they already have. So we are going to focus more on the exercise or the program that it is really fit for them. Through that, we will also ask if they have any family history of any underlying conditions. That is also a risk factor. So we can educate them also to what condition it may lead them to if they don't do this or that.
Okay, just because there's, like what you said, you do not want to add injury into their already pre-existing condition. Now, doctor, a lot of people who might be watching this, who might think, like what you said, there's something off with them. They want to undergo this executive checkup, but they're not really sure because a lot of places in Metro Manila might not have it. Is there a place that people can go to in order to get all of these tests, get the true doctor's, cardiologist's opinion on these matters?
Okay. So at Fatima University Medical Center, we have the Trust the Experts campaign. So this campaign is actually leading those people to have their hearts checked, not only during the heart month or February, but every time of the year, okay, where they can have their tests for ECG, they can have their hearts checked for ECG. They can also undergo 2D echo, especially for those people who already suffered a heart attack. And the stress test, that is for those who are suspecting that they might have heart disease, or even for those who are already active and they just want to check if they can still engage in a more strenuous exercises.
Right.
We know most of the Filipinos actually would like to engage in marathon nowadays.
Right.
So if they want to be cleared whether they're still fit to undergo marathon or engage in more strenuous exercise, they can even undergo a stress test.
Okay. Now, Ms. Cadorna, how important do you think is a well-balanced diet or a correct diet for someone who is trying to recover from heart disease or from hypertension or trying to get out of these lifestyle diseases?
Well, first, it will prevent them to have an increased risk of heart disease again or a recurrence of the underlying problem that you already have. So it is very important because it will also prevent them to gain excess fat. They can exercise more and they can focus more on their goals of not going back to what they already have.
That's right. Do you have a message for our audience?
Yes, I would like to recommend our patients to stay positive, create good habits. If you have already a poor lifestyle, so you have to change your lifestyle into a better one. Exercise regularly and eat well-balanced diet. And also stay hydrated and get enough sleep.
Okay, and let's end this discussion with Dr. Pipo. Do you have your final message?
Since most of the lifestyle diseases are asymptomatic, it's better that if you have already an identified risk factor like smoking, alcohol drinking, lack of exercise, obesity, or you like eating salty foods or fatty foods, you might just want to have your blood checked and you have to have your heart checked also earlier so that you can identify early diseases that might prompt you to suffer from heart attack or heart-related diseases like hypertension, dyslipidemia, or diabetes. And the earlier you catch them, then the earlier you can prevent them.
And with that, we'd like to thank our guests for today, Dr. Michelle Marie Pipo from the Fatima University Medical Center and Ms. Bonaguen Cadorna, physiotherapist from Coach Pro Manila. I'm Dr. Freddy Gomez. Thank you for watching MedTalk Health Talk on CNN Philippines.
Pets at home relieve stress. But what if the pet you love makes you a bit uneasy?
Ever since, talaga may allergy na ako sa dust, pollens, especially sa mga balahibo ng animals, lalo ng aso, pusa. Kaya lumaki ako na hindi mahilig sa mga pets. Pag naglilinis ako ng bahay, bukod sa alikabok, edi maraming mga balahibo na nakakalat. Ayan, maya-maya, hinahatching na ako, nangangati na ako, nagluluha na yung mata ko. As much as possible talaga, iniiwasan ko. Kaya lang, eto yung pamilya ko mga animal lovers sila
Oh, loko-loko na ng baby na, no? Lahat kami sa bahay, animal lover. Except lang kay mama kasi may allergy siya sa aso, lalo na sa mga balahibo nito. Kaya pinagtitake namin siya ng antihistamine, yung Claritin, para kasama pa rin namin siya sa banding at masaya kami buong pamilya.
After mag-take ako ng antihistamine, kagaya ng Claritin, I feel relief. So, na-enjoy ko na yung family bonding namin kasama ng mga anak ko at ang mga aso.